So why do some providers only offer permanent teeth in 24 hours?
Honestly, because it sells. And let's face it, when you're in pain, scared, and worried about the cost, it's easy to be drawn in by a quick fix. We're just starting to see the ripple effect from patients who've been promised 24-hour permanence from providers when it wasn't their best option. You could have pain, swelling, gaps that trap food, receding gums, bite issues, speech problems, the list goes on. I can go on for days. We've had to step in and fix a lot of those issues.
I'm Ash, and if you're here, chances are you've got questions about 24-hour teeth, about healing time, and how you guarantee a permanent smile. Today, we're sitting down with a real ClearChoice doctor to cut through the noise and give you real answers. Not the sales pitch, not the sugarcoating, just the facts you need to make the smartest call for your health, your smile, and your peace of mind. So I'm joined today by Dr. Andrais. Thank you for coming in today.
Thank you for having me, Ash.
It's great having you here. So maybe you start in sharing a little bit about yourself and your background.
Absolutely. So I've been with ClearChoice for the last 10 years. I've been a prosthodontist for 13 years, and I've practiced since I left my residency program on implants. I've done, a few thousands of them at this point, and it's been a great journey for me treating patients and working with them on restoring their smiles.
That's great. We're going to talk about smiles. Let's get right into it. Okay, we're going to get right into it. So is permanent teeth in 24 hours a breakthrough?
Not at all. It's not new and definitely not revolutionary. What's being pushed now is more of a marketing twist than a clinical breakthrough, unfortunately. And the idea of giving patients fixed teeth the same day, ClearChoice actually started that and pioneered that approach many years ago. It's not new. It's nothing new in the market today. We've been doing that, for the longest time ever. We've done same day implants and teeth all in the same day. And we put permanent teeth as soon as we place those implants in the very same day on our patients. And it's definitely not revolutionary. Other providers have run with permanent teeth in 24 hours as a selling point and are marketing it as something new in dentistry. It's a shame, honestly, Ash, because it confuses people. It confuses patients that don't understand the truth behind the message. Just because something can be rushed doesn't mean it should be, Ash, especially when it's going in your mouth for decades to come. Most of our doctors offer this faster zirconia option, but when patients hear the full story of how this plays out, like how healing can affect the fit, how hard zirconia is to adjust later, or how small changes in bite or speech can make a big difference, 95% of patients choose not to do it that way. They want to wait and do it the right way. It's a shame that some companies are presenting this as the only modern or best option, and sometimes even getting patients to unknowingly advocate for it, which doesn't help others that are worried about going through this process on their own. As a doctor, it's tough to watch, but in today's social media-driven world, we see this kind of thing more and more. And frankly, the harder something is being sold, the more skeptical patients should be. They should be asking a lot more questions. It's a bit like what happened with Smile Direct Club. I'm sure some people might remember the name. They tried to disrupt the clear aligner or the braces market by promising speed, shortcuts, and that you didn't need a dentist. You just got to show up and get some impressions done. But faster doesn't always mean better. And now they're out of business. And there's a lot of patients that were left stranded, unable to finish their care because of that process.
So does ClearChoice do permanent teeth in 24 hours?
Sure we do. But we also know that for most people, it's not the best long-term choice. Why? Because your mouth goes through a lot of changes in the days and weeks after surgery. If you put permanent teeth before your gums and bones have healed, you risk locking in something that doesn't fit right or feel right later on. In fact, in the medical world, there's nothing that requires soft tissue management or surgery that you get permanently in the same day. That includes prosthetic legs, that includes prosthetic ears. There's nothing in the medical world that we today do in a 24-hour and deliver a final product or final prosthetic to the patient from. So this idea is foreign to dentistry just as it is to medicine. And fixing that later, it's kind of frustrating, expensive, and avoidable. It's frustrating for the dentist. It's frustrating for the patient because it requires more appointments later when it's not done properly. I like to tell my patients, we get one shot at doing this. And we believe and we put every effort behind that first shot. And we want to make sure that it gets done for them correctly. Nobody wants to go through this twice. And I think the worst stories in my career are patients that come see us and I make a recommendation and they decide that they don't want to move forward with it. They disappear for 2 years and I get a call and they want to see you. And I'm like, who wants to see me? I'm like, well, this patient that you saw 2 years ago. I said, that was just a consultation. And they sought treatment somewhere else. But they show up 2 years later. And it's the saddest message to deliver to a patient, which is, I'm sorry, but everything you've done was done incorrectly,
Yeah.
and we have to start over. So there's the agony of going through that psychologically, and there's a financial piece of this where you paid once and now you're coming to pay twice for something like this when it shouldn't have been that way because it was a slam dunk in the beginning for that patient.
Yeah.
So that part is really painful for us when we have to deliver a message like this. And what we've been seeing lately with these permanent teeth in 24 hours is implants that may not have been put in the perfect position for the patient. And now they're healed, and now you have to start the process from scratch. How could you deliver teeth in 24 hours and have that considered when you don't even know where the tissue is going to heal? That's why we don't rush your smile. We get it done right the first time.
Then what does ClearChoice do instead?
We call it teeth in a day the right way. You still leave with a full smile the day of your surgery, custom made for you. But we don't finalize anything until your mouth has completely healed and settled. Instead of locking everything in too soon, we use our technology to make sure everything fits exactly how it should and how we promised you it would. Your doctor checks that your implants have taken, then fine-tunes the details, your bite, your speech, your comfort, even your tooth shade and symmetry. Some patients come in and want something different about their smile that they've had before. We get to do that for them. And yes, you'll be out of pain immediately after surgery. No trade-offs there. That means a better fit, fewer long-term complications, and a smile that's truly yours for life. So you still get your smile at the same day, but it's designed to evolve with you, not against you.
Why would you need to verify that implants have quote unquote taken?
That's a really good question. Because your mouth heals after surgery, just like anything in your body. The swelling goes down and the gums and the bones change to this new thing that you just placed into it. And that can lead to gaps, food traps, infections if not handled properly, speech problems, basically a poor fit over time. We're the only provider to offer same-day full arch dental implants that give you the best of both worlds. A new smile that you get to leave with that same day and flexibility to fine-tune it while your mouth naturally heals. You wouldn't buy a car without test driving it, would you? So why would you commit to a smile without really understanding what it looks like first? You know, what I tell my patients is that you get to drive the car before you buy it. And if you don't like it, you can come back and get another one. Try a different color. Try a different seat, a different fit. And at the end, when you say, I like it, we give it to you.
Permanent teeth in 24 hours. That sounds so convenient. Like, why would I want that?
It does sound convenient. We're in a world where everything is moving fast, so why wouldn't you, right? We get it, and it's tempting to want something permanent right away. But if you lock in things before your mouth has had a chance to settle, you risk long-term complications. And in reality, not everyone qualifies for permanent teeth in 24 hours. Even in the places that exclusively offer it, they often change the plan mid-surgery when they realize it's not viable. At ClearChoice, more than 98% of patients qualify for our same-day approach because it's more flexible, it's predictable, and patients have a say in what they get at the end. We've been doing this for more than 20 years and placed over 1 million implants, and we've seen it all, including the most complex of cases and how these cases age in patients' mouth. We know what works, and we're in it for the long haul with the patients with a lifetime warranty to prove it and a program that helps them maintain the teeth after they're done with their treatment.
So are there times, though, when 24-hour permanent teeth are the better option?
In some cases, yes. If someone has a very specific need and understands the risks, we'll explore the option with them. It's not a one-size-fits-all. We tailor the plan to the patient's needs. But for the vast majority of patients, it's not about what's fastest. It's about what's smartest and what's best for the patient to have an outcome that lasts a lifetime, like I mentioned.
So then would you say that ClearChoice is actually more advanced than these 24-hour smile clinics?
I would say so because our process is designed for precision, not hype. We have in-house labs, 3D imaging, advanced materials, and a whole team of specialists, surgeons, prosthodontists, and lab techs, all working together under one roof. That gives us complete control, so we're able to streamline everything without cutting any corners. You get better coordination, fewer appointments, and a treatment plan that's truly built around you. We've been doing this longer than just about anyone in dentistry. We're constantly innovating, refining, and improving. And in fact, our approach is the only one that combines same-day teeth with built-in customization phase. Other places charge extra if your teeth need adjusting. We plan for it from day one. And here's another big difference. We don't disappear after surgery. That's a huge thing for us. We believe in the work that we provide for our patients, and we want to be with them for the rest of their lives, maintaining it and taking care of it. You don't get shuffled off to a third party if you still don't like your smile. We're with you every step of the way.
What kind of problems have you seen from this 24-hour permanent teeth process?
Unfortunately, too many. mostly bite and aesthetic issues, and patients come to us with speech issues sometimes because they didn't get any training in this new set. Again, God forbid someone falls or has a surgery, they have to go through physical therapy. Why is the mouth any different? When you're in that initial set of teeth, you get to go through this training period. You get to test it out and to come back and tell us what you want to see differently. And from there, we're able to tailor the final prosthetic to your liking. The saddest part, most of these patients thought they were getting the best. That's the risk of these oversimplified promises, Ash. You think you're getting state of the art when really you're just being rushed through a one-size-fits-all approach. We're just starting to see the ripple effect from patients who've been promised 24-hour permanence from providers when it wasn't their best option. These procedures may look okay in the beginning, but as your mouth changes, problems can surface, and that's what we're seeing today. We've had to step in and fix a lot of those issues. And unfortunately, it's a difficult fix because now you have to redo a lot of the work that was done initially. One of the most important things we customize is your bite and your speech. If those are not right, it affects how you eat, how you talk, even how confident you feel. That kind of precision just isn't possible when everything is locked in on day one. We'd rather help you get it right the first time.
So why do some providers only offer permanent teeth in 24 hours?
Honestly, because it sells. And let's face it, when you're in pain, scared, and worried about the cost, it's easy to be drawn in by a quick fix. We all want simple answers to complex problems. It feels good to be told it can be done in one day, no worries. But good medicine isn't based on hype. It's based on evidence. Look for long-term results. Look closer at the reviews. Look for clinical studies that go back more than a few years. You won't find much, if any. There's a reason for that. At ClearChoice, we've placed over 1 million dental implants, and every year we're getting better because we're building on a 20-plus years of data and real-world results. Our doctors are specialists in this. It's all they train for. We know what works, what lasts, and how to truly personalize the care towards the patients. We have thousands of 5-star Google reviews from patients in cities across the country. The difference is our experience and customization and the results that last.
All right, so what are the most common issues that you see with permanent teeth in 24 hours? I guess a second question is, when do those problems typically surface?
That's a really good question, Ash. Sometimes it's months and sometimes it's years, but it happens. It's easy to make implants last a few years without issues, but it's much harder to make them last a lifetime. And that's why long-term data matters. You could have pain, swelling, gaps that trap food, receding gums, bite issues, speech problems. The list goes on. I can go on for days. Why? Because your mouth wasn't done healing. It's not designed to take on this new prosthetic in a day. If you're already having issues, don't wait. Book a free consult and we'll take a look. No pressure, no obligation. Your smile is too important to gamble on shortcuts. That's why we stand by our work with a lifetime warranty.
Okay, so what should I look for if I'm choosing a provider, if I'm out there and, I'm having some of these issues?
Well, of course, I'm going to be biased here, Ash, but I would say start with experience. Find a team that's placed implants for 10 plus years, minimum, I would say. Ask for 10-year results, not just photos from a few years ago. Look for specialists, not generalists. Look for a coordinated team, not providers who hand you off. Look for a place that doesn't rush your smile or your decision. Look for someone who guarantees their work, not just for a few months, but a lifetime. And if a promise sounds too good to be true, you know the deal. Ask more questions.
All right, so let's talk about cost. This is a big investment for a lot of people. How should we think about that?
It is, and we never take that lightly. It's also one that can seriously change your life. We try to provide you with different options that work within your budget. Here's what I can tell you. At ClearChoice, everything has been purposely designed around one goal, which is getting it right the first time and making it last a lifetime. That means your oral surgeon, prosthodontist, and lab tech are all working together under one roof on a treatment plan made just for you. No one size fits all. You're paying for a team that has done this thousands of times. We've placed over 1 million implants. We do this day in and day out. We use the best materials. It's our thing. Our tech and our process allow us to give you a level of customization and ongoing care that you can't find elsewhere. We even back our zirconia with a lifetime warranty. We don't believe in surprise fees or shortcuts that cost you more down the line. So yes, it's an investment, but it's a thoughtful, evidence-based one. And your consultation, that's free. No pressure, no gimmicks. We'll walk you through every detail, including your finance options, so you can make the decision that's right for you. This is your once-in-a-lifetime smile. Let's build it that way, safely, beautifully, and with zero regrets. And if you're still not sure what's right for you, that's exactly what a free consultation is for. come see us.